Hello, my name's Steve and I'm based in Liverpool, UK, and welcome to the Northwestern Approach, which is coming to you from my bunker, which is in fact the cellar in my house. And just to give you a little bit of background about me, for the record, my professional background is in education and my qualifications reflect that. I've also worked in business and had a company here in Liverpool for many years, and in the sector of educational tourism. So that's just a little bit of an intro to me. This is the bunker. I'm new to this, so we'll just see how this goes. You may have noticed that. I'm making this video in the bunker, which is my cellar, because it feels like the right metaphor for the situation that we all seem to find ourselves in right now. The name Northwestern Approach is partly based on the name given to an underground bomb shelter in Liverpool, which during World War II, which was called Western Approaches, and which tried to protect the transatlantic convoys and warn of German submarine attacks, etc. So I thought that would be quite something related to that might be quite useful for my purposes in making these little video shots. And the reason why I'm doing this is just to add my voice to the multitude of voices out there, ever increasing multitude of voices out there that are questioning and discussing the current coronavirus issues. I'm not particularly about the coronavirus itself, which of course is not that it doesn't exist, it clearly exists, that's not the point, but it's the political response from the government and from the newly established public health militias that is getting really rather disturbing. So I'm looking at a lot of both national and international productions that provide perhaps an alternative view outside of the mainstream that seems to me more often than not more credible. So for those of you who aren't in the locality or in the UK, you may or may not know that Liverpool is now entering another lockdown, or lock up as I prefer to call it. And so many of our freedoms again are being curtailed and ultimately denied, and with the imposition of some extremely draconian new rules and regulations, which apparently have been given the force of law, which is extremely worrying, and it would seem there are more on the way. With every day we hear about new laws, new rules and regulations, lack of civil rights, lack of appeal. I'll go into that in due course as we move on. So on that note then of the Coronavirus Act 2020 was only last week reviewed and agreed again by Parliament, even though approximately 300 MPs, my MP included, abstained from the vote. And that was a long, meaningful look into the camera there. From 300 MPs abstained from one of the most important parliamentary votes of the 21st century. Only 20 years into the 21st century, but I would say it's probably one of the most important parliamentary votes of the last 100 years. And this tells me a lot about the state of democracy in the UK at the moment. And so effectively I would say that if you represent the people of UK, how can you justify abstaining from a vote which is predicated on the denial of the nation's civil liberties? How can you abstain from that? There's a question. From me to you, anybody listening, anybody got information about this kind of thing, please contact me on northwesternapproach@gmail.com, northwesternapproach@gmail.com. So I think if I don't say something now, then that opportunity may be denied me in the coming months and years. I fear that, and I'm pretty certain that what may be considered by some to be dissent and what is considered by me to be discussion and argument which I think is a democratic right and a democratic principle, I think those opportunities will be denied in the not too distant future. I think by the time we get to next spring, we may be well into a very, very different world. Okay. So I'm speaking really on the basis that we still live in some kind of democracy. I'm hoping that we still live in some kind of democracy and that what I say counts. Although I did actually write to my MP in June about the new COVID laws that came into force, but I didn't get a response. So not terribly democratic perhaps, but I give all the excuses, you know, maybe my letter didn't arrive because of the virus or whatever it is, but something is clearly amiss. So I've sent it off again, this time in by email, and hopefully I'll get a response in the not too distant future. Hopefully. So I don't really see an awful lot of signs of many signs of democracy around me at the moment, and in fact I haven't done for the past 20 years. But more about that perhaps another time. So my plan here is to review as much as I can of the current information being presented in UK and overseas, and to compare what's being said in order to find common threads in terms of political responses to the virus. There are lots of very, very similar political responses to the virus, and they all seem to be predicated on the idea that, well, civil liberties must be curtailed in order to deal with the virus effectively. But what I fear about this is that those civil liberties will not ever come back, because that's in the nature of the government to not want to do that. Civil liberties are hard won and often fought for. So I think, and I may be wrong, but I doubt it now on this point, that they won't be coming back. We'll sink more and more deeply into some kind of totalitarian state over the next year. Quite quickly, I think. So, overall, I look at the situation in France, and in particular the port cities of Nantes and Marseille, etc. As I speak the language anyway, that's the principal thing, and I keep in contact with French media and French news as much as I possibly can, and I'll gauge that similarity of experience here in UK. I'll also look at the USA, because it's a pretty big, important part of the world, and in particular New Orleans. And the reason why I chose New Orleans is, one, well, I really like the music, and because of Liverpool is called New Orleans' sister city, because they're both port cities. The concept of sister cities was created by Dwight Eisenhower in the 1950s. I don't know that many people in Liverpool know that it's twinned or sistered with New Orleans, but it's a good opportunity for me to listen to music, and hopefully to get some information from people in New Orleans who are based there, maybe to tell me a little bit about what's going on. I suspect there are a lot of similarities between what's going on here in Liverpool, what's going on in New Orleans, and what's going on in the various port cities and other cities, of course, in France. Not just port cities, but my interest lies there. So I thought, apart from port cities, what would be a defining factor of the similarities and the common threads between these three areas? Well, I thought, well, having a quick look on the internet, I couldn't find much else, but I did notice that, well, unemployment is massive in all three of these areas. And so I've got some statistics I'll read out to you now that I've got on my screen, which I'm referring backwards and forwards to, as you may have noticed. Liverpool, 18.6% unemployment, according to the BBC, 20th of July, so that's quite old. This is a youth figure between the ages of 18 and 24, but nevertheless, 18.6% is a state government figure disseminated by the BBC, so that's probably a very cautious figure, and I would estimate that the real figure is somewhere around 40%, because youth unemployment in UK and in London, I can guarantee, is 40%, because those statistics aren't too difficult to find about London. Marseille, 19 to 27% unemployment. This isn't youth unemployment, this is overall unemployment from the age of 18. Depending on the area of Marseille that you live in. And I got that from Made in Marseille, January 2019, even before COVID. So I suspect, again, that's gone up an awful lot since January 2019. Difficult to get the exact figures from these today, oddly. New Orleans, 20%, and that's I read that on what's called Fred graph, cited by the US Bureau of Labor Statistics 2020. So that's a more up-to-date one. So in the New Orleans, it's 20% now at the moment. So I think, as I mentioned, the UK government always manages to massage figures. And when I say we have 18.6% here and more likely 40%, it's because the government massages figures and manipulates them to make it look like the actual rate of unemployment is much lower than it actually is. And there are reasons to do this. Well, obviously political reasons to do this, and they do this by attributing large numbers of unemployed to training programs. They just invent a training program that goes nowhere, does nothing, trains very little, and the clients come out with less opportunity of finding a job than they had when they went into it because they've wasted time. That's a very typical situation here in UK, and I suspect it's a very typical situation all around the world. There was actually a time when you watch the news in the evening on television in UK, we got the unemployment numbers. Always at the end of the news, unemployment today in UK stands at, I don't know, 1 million, 2 million, 3 million. Various times it's been really very high. But they don't do that now. We don't get these figures now because they're probably a political embarrassment. And what we get is the stock exchange figures. And oddly, right through COVID, the stock exchange seems to have rallied. And lots of companies making, and lots of people making, as a friend of mine described it, obscene amounts of money on the stock exchange since the beginning of COVID. It's not a very good sign, really. So today I want to look at one or two, I can only term COVID scandals. I want to look at COVID scandals. And the first one I want to look at is the COVID scandal is the cost of the PCR tests. Don't know how it is in your country, France, USA, but here it's astronomically expensive. So the BMJ, British Medical Journal, on the 9th of the 9th, 9/11, yeah, stated that the government will spend 100 billion on 10 million COVID PCR tests in the coming year in what it calls Operation Moonshot. Yeah, it's a little bit James Bondy. Fantastic is the idea. In ready reckoning, this works out at about £36 a test. I mean, that's just my ready reckoning in my head. And we'll all be having multiple tests every day. And I'll repeat that. We'll all be having multiple tests every day if we want to go to work, get on the bus, go to school, take the kids to school, get on an aeroplane, go to an office, all the different things that you have to do on a daily basis. You'll be tested before you go in. There's a massive amount of testing. So this figure also represents, in fact, the same amount of money spent on the entire healthcare system, which is the NHS, National Health System, in UK. Almost exactly the same budget. That's a lot of money, isn't it? And I'm not sure that it's going to be terribly worthwhile. So this 100 billion will be every year, not just a one-off. I say this because if you listen to Dr. Didier Raoult, infectious disease expert at IHU Marseille in France, there are to date 7 COVID mutations. 7 COVID mutations. According to Dr. Raoult, the mutation spreading around at the moment is number 4, and it's not the same as the original virus. It spreads more easily, but doesn't make you as ill, apparently, according to Dr. Raoult. I can't explain why that is. I don't have any background in the medical sciences, but I take his word for it because he's a famous figure as an infectious disease centre in Marseille. So And he was the doctor that sort of proposed in France the use of hydrochloroquine, and used it effectively. And I understand that I think only one person died in his entire hospital in France, in Marseille. Not the same in other parts of France where he wasn't treating these people. So I wonder which one the PCR test will test for. Will it be the original COVID? Will it be mutation 4? Will it be mutation 7? Can these PCR tests be manipulated so that they can test for anything? Well, maybe they can. We'll find out about that. So, as we all know, influenza vaccines aren't effective due to a virus's ability to mutate quite quickly from one season to the next. So if we have PCR tests and they aren't actually equipped to deal with a whole set of mutations of viruses, then an awful lot of money is going to be spent. Well, 100 billion in fact. And this seems to be the same for COVID. If COVID is mutating like an influenza virus, and if it's mutated 7 times since it came into being spread around since last year, since probably about November, December last year, then which one is being tested for? I suspect there'll be an awful lot of hype about this because an awful lot of hype is put into the 100 billion that's going into it. So there'll be a lot of hype about how effective it will be. But the outcome, I think, will be lots of vaccines several times a year, every year. Not a happy thing to think about. I also note the government will not be paying for face masks, despite the fact that they are now mandatory in many environments: schools, shops, offices, universities, schools, everywhere. Everywhere you want to go, the bus, the train, planes. So this is seems to me to be very good business if you're a PPE manufacturer with a government contract. So PCR tests, 100 billion. That's an awful lot of money over the course of a year. The outcome of the tests is doubtful anyway. We're becoming aware of that. I think that the statistic is something like about 85 to 95% false positives. And as I understand it, PCR tests can give you the answer that you want. According to Kerry Mullis, who was the inventor, and if you watch the video which is doing the rounds on social media right now, you'll see him saying this, and that strikes me as being sort of quite alarming, especially when the political response to COVID is predicated on everybody being tested and the number of cases. So if we've got 85 to 95% of cases are false positives, how many people have the virus? How many cases are there? And of those, how many are benign mutations? 2, 3, 5, 6, 7. And how many are the more serious? More serious is that people have been hospitalized with the original COVID and mutation 4. The original COVID clearly had quite a lot of effect on people of a certain age with lots of with various comorbidities, whereas mutation 4 doesn't spread as easily, but does have a capacity to lay you low if you have other comorbidities. So we'll see. This is just an introductory video. I'll do some more in a day or two. I'll gather my facts. I'll put this on YouTube, of course, and underneath I should be able to put the notes where I got my information from, my references, and you can take it from there. If you wish to check it, what I've said, great, please do. I would encourage you to check everything I say. Don't take it for granted. Fact checker, be your own fact checker. You don't need any government site to do this. It's just basic research. And get back to me. Let me know what you think. Tell me if I'm right or wrong. Give me your arguments. And please, people from France, if you have the time and you're interested in what I'm saying, please get back to me. If you're in the States, the USA, please let me know if things in your town, your city are really difficult, and we can make a comparison of what's going on in various parts of the world, certainly France, UK and USA, other places too. I'll be very interested to do that. So my name's Steve, I'm from Northwestern Approach, and please contact me on Northwestern Approach at gmail.com, northwesternapproach@gmail.com, and I look forward to hearing from you. Thank you. Bye.